shows culture colonies on BAP or blood agar plate, and McConkey and biochemical reactions are as follows. So in your case, you will be given also pictures of different colonies grown on a culture medium as well as different biochemical tests. So this is the gram stain result. It's a gram-negative bacilli. This is the culture showing on blood agar plate. It shows grayish-white colonies with thick, moist, and beta-hemolytic. On a McConkey agar, the culture shows pink to red lactose fermenting colonies. So biochemical shows the IMVIC result as positive, positive, negative, negative. So this is your indole on the first group. IMVIC stands for indole, methyl red, D is both for scour, and C is for citrate. So you read the notes that I gave you. And this is the TSI result. The TSI result is acid, acid with H2S negative. So that's yellow over yellow without any blackening at the bottom portion of the tube. So what are the information or what are the general informations necessary on your case? So for general information, you state the patient's initial. If ever you'll be given class patient name, do not write the patient's name. You just write patient's initial. For example, Carl J. Brigante. So you just write CG B. Okay? So do not write the patient's complete name for private tests. Okay? So you also provide the age of the patient if they're given in the case, the sex, the race, the religion, and the date of admission. So for our case, this is a 19-year-old female. Okay, there is no patient name. For subjective and objective information, you write here the chief complaint and the other symptoms. So the chief complaint, it is where class symptoms or signs. That's why the patient goes to the doctor or to the clinic. So the chief complaint is left flank pain and fever. So fever only is not a chief complaint because if fever lang, di ba? Mag-fever lang ta sa house, dili man ta necessary mato og clinic or hospital. Pwede raman na nato i-manage sa balay. But the patient went to the hospital because of the left flank pain. Okay? So that's the major chief complaint. Other symptoms, you also there, chills, increased urinary frequency, and foul-smelling urine. For the history of the present illness here, on this slide, you note about the state, or the order of presentation of the symptoms leading to your diagnosis. So it should be in chronological order. Also, give pertinent negative symptomatology. So for example, in our case, so 5 days prior to admission, that's PTA, the patient has experienced nausea, but without vomiting. So 1 day prior to admission, patient experienced left lung pain, fever with chills, and increased urinary foul smelling. So if you notice, there is positive sign, meaning the patient experienced it, and negative sign, meaning wala siya experience, ana. So for past medical history, here, you briefly state in chronological order still, patient's childhood illness, adult illnesses, and hospitalization. So in the case, she has a recurrent UTI, di ba? So pagbalik-balik yung UTI niya. So if ever nakabutang dira class na she was admitted before due to surgery, so you're right also, because that's part of medical history. Family history, does any disease run in the patient's family? So if ever there is information provided, you're right. But for our patient, we do not have any information, so we just write undisclosed. Social and drug history. For social and drug history, you write what or if the patient is smoker, if the patient is social drinker, no? So you write there. So kung smoker, how many cigarettes ang maubos niya in a week or in a day? For drug history, if ever the patient is taking any drugs or any medications. For example, for a disease, for a certain disease, or just a ang tawag na to, medication niya. For example, if ever the patient is high blood, so parang maintenance niya na drug. So you can write it there. So for our patient, we don't have any social history. So we just write ampicillin because she is taking ampicillin. She was taking ampicillin as drugs of treatment for his recurrent UTI. So for comorbidities, so you're right, if there is mentioned comorbidities on the case, if not, then you just none. For physical examination, here you write what are the physical examination done by the patient, by the physicians to the patient. For example, here, so the patient with the vital signs, the temperature is 38 Celsius. So abdomen test, no, left orthopostural tenderness. So physical examination also include respiratory rate, no pa, pulse rate, there. So pertinent labs, for pertinent labs class, you write what are the results of the laboratory tests given. So for our patient, we have urinalysis, diba? So urinalysis, you have 3 to 10 RBCs. So you also have more than 50 WBC and positive 3 bacteria. Also, the patient undergo microbiologic testing. So gram stain result shows of the urine gram-negative bacilli, and culture shows 105 or 105 CFU per ml beta hemolytic and lactose colonies. So for the differential diagnosis, no, you write what are the possible disease, no, of the patient based on the signs and symptoms. So here it is not specific yet. So you can write UTI, pyelonephritis, and even renal stone. So UTI possible sa patient because pabalik-balik iyang UTI. Pyelonephritis, pwede. And possible din siya, baka may renal stone siya. So here, for the differential diagnosis, you just base this on the symptoms of the patients. Okay? So how do you do your differential diagnosis until you come up with the actual diagnosis? So you do conceptual framework. So first, here is the major chief complaint, left lung pain. Then the patient also have urinary symptoms. So you consider UTI and nephroteliasis, okay, or renal stone. Then physical examination is done. The patients reveal costovertebral tenderness of the abdomen. The patients undergo urinalysis. So, diba sa urinalysis, you have two results, major results, pyuria, because WBC is present as well as bacteria is present, and hematuria because RBC is present. So, hematuria, if hematuria alone, you just consider nephrolithiasis. If pyuria, meaning there is pus, no presence, WBC, so you consider UTI and pyelonephritis. So you further evaluation, there is acute lung pain in adults. In nephrolithiasis, normally there is absence or rare symptoms, no lung pain. Usually it's associated with UTI or pyelonephritis. So after you do your conceptual framework for differential diagnosis, you now do the your final diagnosis. So for this case, the final diagnosis is urinary tract infection. So since you are also given with pertinent lab results, particularly on the microbiologic side, we also discuss the organism. So for the organism, you try to consider different organisms. Here, di ba? In your case, you are given gram-negative bacilli causing UTI. So you identify what are the possible organisms that are gram-negative that can cause UTI. So here, you can consider Klebsiella pneumoniae, E. coli, and Enterobacter species, and even Pseudomonas aeruginosa. Okay? In the case also, you are given culture results in the culture media. So on sheep's blood agar, it's grayish white, thick beta hemolysis, and on Imacon key, it's pink and lactose fermenter. So since you already have their bacteria that you consider, you try to rule out. So for Klebsiella pneumoniae, it's usually rare beta hemolytic and it's a common lactose fermenter. For E. coli, it's common beta hemolytic and common lactose fermenter. For Enterobacter, it's rare beta hemolytic and common lactose fermenter. For Pseudomonas, it's common beta hemolytic but it is never lactose fermenter. So here pa lang, the Pseudomonas is already ruled out. Okay, so wala na siya. So you will only consider the 3 na lang remaining bacteria. So you do also go now to the biochemical results. So for biochem, you are given IMVIC positive, 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 negative, negative with each anti-SI is acid, acid with each negative. So for Klebsiella, it's the IMVIC reaction, negative, positive, positive, although it's acid, acid, H2S negative. So here, the IMVIC reaction is not similar to Klebsiella, so Klebsiella is out. So for E. coli, the IMVIC reaction is positive, positive, negative, negative, which TSI result as acid, acid, neg. So for E. coli, then similar, ato siya i-check. Then for Enterobacter, we'll try to check again the IMVIC reaction. It's still negative, negative, positive, positive. Then, although the TSI result is acid, acid, H2S neg. Since they do not have the similar IMVIC plus, so Enterobacter and Klebsiella is out. So, ang similar lang among the 3 is the E. coli. So therefore, E. coli is our organism or the causative organism of the case. So that's your final organism. So on the succeeding slide, you discuss now the taxonomy, about taxonomy of E. coli, the characteristics of E. coli. So you should be presenting this in different slides. So one slide for taxonomy, another slide for characteristics, another slide for virulence factors, the types, okay, the culture, and the biochemical reactions, as well as diseases. Because E. coli is not only limited to UTI, E. coli can also cause gastroenteritis. So, us also. So, here, for the characteristics, I want you to discuss what are the gram staining reaction. Okay. For the virulence factor, you discuss what are the virulence factor and its action. Again, for the virulence factor, discuss the virulence factor and its action. The types, what are the different types of E. coli? What are different strains of E. coli? So that's it. So again, one slide for this one. So you'll end up slides discussing your organism. Okay. Now let's go to your case rubrics. So you will be graded according to these rubrics. So for the case presentation, this is a group score. Okay. So you will be graded according to organization, how you organize your slides, the content of your discussion or your slides, the delivery, how you deliver, no, and how you respond to the question. So every case, every group will be given one case. It depends, okay? So every week, siguro mga three groups will report para mahumantanan. Okay? And you will be graded for this as group. Okay? But for the case presentation class, you need to present it individually. Okay? Although you will be graded as a group, but you need to present it individual. So meaning, group leader, you assign which member ang mo discuss aning a part. Okay? Because gradan sa na sila. Aside from the case that you will be presenting, you will also submit written report. Your written report will answer the different guide questions. So each case class, at the end of each case, there is guide question. Okay? So you answer those guide questions and you will be graded well. So for that, you have organization, correctness, and the timeliness of the written report. Meaning, you submit the written report class a day. You can submit it a day before your case presentation or on the day of the case presentations. If late gani siya, then minus na siya. You need to submit also your written report to your classmates because during your case presentation, aside from the teacher will ask group, the group who presented the case, we will also ask questions to the audience. So these questions, you will be asked questions, di ba? So you will be graded as well. So this will serve another points for verbal examination. So for example, si group 1 karon ang mo report sa case 1. So si group 1, ang katong mga members sa group 1 mangutana mi because that's part of there is one criteria that will respond that responds to the question. So at least mangutana mi mga 3 questions to the group. But we will also ask at least 5 students, different students not included sa group that will answer the question. So whenever the student cannot answer that question, then wala siyang score for the verbal exam. So that will serve as your verbal examination score. So every week, lain-lain na tawagon ang names for the verbal examination points. So para naamoy additional score. So if ever dili maka-answer, then 0. If ever maka-answer, duol-duol sa answer, then if ever sakto gid yung answer, correct gid siya, then 10. So your scores will be 10, 5, 0. Okay. Questions. Clarifications. We will be sending the case ahead today. I'm still preparing the case. So I'll be sending it messenger sa mayor. Then I will also assign which group who will present the case. Your case presentation will be done next week, on Saturday. So we will assign lang which class ang morning and which another class ang afternoon. Okay. Again, also next week class on the Saturday of your laboratory exam, laboratory face-to-face rather, there will be a long exam for both lecture and lab. So you study lectures. We already give study guide. For the laboratory, I will give a separate study guide for that. Questions? Clarifications? Oy, question.
None so far, sir.
Kagets?
Yes, sir.
Okay. This case presentation class, the written case, as well as the case is part of the lecture. Okay? So again every time there will be case presentation, we will be expecting you that you will, because we will ask random questions to everybody. Okay? So for example, karon nga din natawag imong name nya wala ka. So wala na kay chance to answer. Next, you will give us reason why you are absent. Okay? Questions, clarifications.
Sir,
Yes.
about sa pag-report, sir, visual aid needed, sir, via PowerPoint, sir, or isuwat?
Because we will do it sa Saturday man, di ba? Or kung ang sa availability sa Saturday, I think Saturday ang best. If, yeah, Saturday. We will do it online. You can, have it anywhere. Kung pwede mo mag-meet as a group, no, during your case presentations para dili mawala-wala ang uban. So you can look for a stable internet.
Good afternoon, sir. Week 5 ang ilong quiz next week, sir. Week
Yes.
5 topics. Okay, sir. Thank you.
Make sure you have already the study guide. I already gave the study guide. So for those that are under Sir Luigi, you ask the study guide of Sir Luigi, from Sir Luigi. Try to study in advance. There are transcripts of the recorded lectures, so please read those transcripts.
Sir, question, sir. So ang first case presentation, sir, will be on August 6th, sir.
Yes.
So, morning ra ba, sir, kay nami quiz sa HEMA.
Morning name nyo, di ba? Saan yung quiz sa HEMA?
Sir?
Afternoon, di ba, yung case sa HEMA? I think you will only have 1 hour quiz for HEMA. Na ato i-announce si Sir, ato i-ingon ako si Sir, sino ganit na inyong game mo? Sir Joshua. I will ask again kung what particular time ang inyong long quiz for HEMA.
Excuse me, sir.
Yes.
Sa amo, sir, sa A8 kay ang among mga quiz kay 1 to 2 p.m.
Dili day sabay tanan inyong long quiz.
Ay, sa
Yeah,
8 to sir, kay 1 to 2 p.m. po.
I think all of you will have the same time for hematology at long quiz.
Wednesday,
sit lang.
Saturday, right?
Opo, sir. Afternoon pa di ay. So, morning po, sir, next
Saturday
time.
afternoon. So, if ever you'll have a long quiz on Saturday afternoon, if ever ka mga section ang ma-assign ana, then move after your long quiz. Any questions? Clarifications?
sir,
Yes.
kanang last na, sir, ang i-clarify, sir, ang first na case reporting, sir, is online, sir.
We'll have all the case reporting online.
Then, mag-start, sir, sa karong next week, Sabado, sir.
Yes.
Okay. Yes, sir.
Good morning, sir.
Yes.
Good afternoon.
Ano?
About sa PPT, sir, pwede mo mga sa example PPT? Sa
Yes.
example PPT, sir,
That-
pwede mo mga
I'll be sending the PPT today.
Okay, sir, thank you.
I'll be sending also the case for next week ahead of time and the group who will present.
Sir, naamoy ko answer ka ng time limit ang each presentation, sir.
Yeah. Each presentation you'll be given at least 30 minutes to present.
Appeal na ng mga katong questions, sir, sa
Questions,
Nemo, sir.
after.
Okay.
So I will give 30 minutes for you to present the case, and then 5 minutes for Q&A. Then we'll have another 5 minutes for questions sa mga classmates din mo,
Sige sir, thank you sir.
so that we can maximize the entire at least 3 hours for the 3 groups. Any questions? Clarifications?
Oh, good morning, sir. Oh, good afternoon na din ka ng sa tanang section, sir, baka ikaw ray mo facilitate.
Hindi, si Sir Luigi sa ilang sa inyong section.
Tamo sige, thank you,
Yes.
sir.
So you ask Sir Luigi which time pud mo mag-start.
Okay, thank you, sir.
Okay? Sige. Questions. By the way, you check your scores per P1. We already gave scores per P1.
Ay sir, nakoy follow-up question sir, baka nang ang mag-speaker sir mo na mo present sa presentation, pero ang pagtubag sa question sir baka kanang bisag kinsa sa among grupo sir or katurang speaker ang mo tubag.
No. 'Di ba, as I said kanina, dapat tanan hatagan og part.
Okay.
Okay, so you divide the task.
Okay.
So pero ang motubag sa question bisag kinsa lang basta sa group, within the group. Questions?
Good afternoon, sir.
Yes.
Pwede magpa-repeat about sa katubitang written report, sir, if unsay buhato na mo ato, sir?
Written report, you will answer, di ba? If you will see the case later, class, you have the case on the first part, and then ang the last part kay na siya marag study guide questions. So you answer the study guide question. Moto inyong written report. You answer it in an essay format.
Thank you, sir.
Okay? So when you answer it, make sure class tanan answers ninyo kay naay references. So you write you do in-text citations and you write the full reference at the last page of your written report. So for your written report, I expect on the first page, that's the cover page, you write all the members of your group and the title of your case. And on the last page is your references. Okay? So by the way, class, when you present your case, we encourage to make your own title related to your case. Okay? So parang another additional points kumbaga if you can make your own title. So you just dili necessary nga ang title ninyo kay ang organism or ang kanang inyong diagnosis. So you make your witty or be creative with your title. And make sure your title also related naman sa inyong i-present na case. Okay? Questions? Yes, Miss Tomiko.
Hi, sir. Good afternoon, sir. With
Yes.
regards sa written report, sir, baka by group gyapon ang
Yes,
pag-submit, sir?
may group yapon siya tanan.
Okay, sir. Thank you, sir.
Next. Question? Kinsa pa to? Kamatso?
Excuse me, sir, kanang open na ba ang school ika-Saturday in case adto mi mag-meet sa ka-group para mag-report or
I think
in ana?
open ba ang school?
Okay, sir, thank you.
Question? Clarification? Okay? When you do your report class, try to maximize every references that we give you. Diba? I give you links to different textbooks. You can also maximize journals. So please maximize those. Any questions pa? Clarifications? Pangutanan na kay taod-taod mangutanan na sad sa chat.
Good afternoon, sir.
Yes.
Through online ra i-submit ang written report,
Yes.
sir.
I will give you the link where you will submit your written report.
I-submit na namo siya, sir, the day na mo present mi, sir, or dungan tanan groups.
Submit niyo sa the day mo present. You need to submit it and share it to your classmates as well para kabalo sila, makastudy sila.
Okay, sir, thank you.
Your written report should be shared a day before or on the day before before your presentation para inig-ask na ko sa inyong mga classmates kay makatubag sila sa nasa sila idea sa inyong ang report. Okay? Any questions? Miss Camacho, are you okay na? Do you have any questions pa?
Ay, okay na sir, sorry.
Okay. Ask questions now. Next week during the laboratory, bring still PPE. Okay? You will be performing biochemical testing next week. Yes, Kat.
Ana, for the long quiz next week, sir, ba kay maggamit katong pencil gihapon among gamiton?
Oo,
Sa
yes.
hall? Wala. Thank you,
We will
sir.
still maximize the scantron.
Okay, sir. Thank you.
Miss Montejo?
Sir, good afternoon, sir. For the reporting, sir, ba, pwede rami magdala og kanang index card, sir, for something na mag-reference na mo while mag-report mi, sir?
Yes.
Thank you, sir.
Any questions pa? Clarifications? Questions pa? Clarifications? Wala? Okay. Last week, I received news about test paper. So again, class, this is just a reminder. If we caught somebody magingon ana, the consequence for that is suspension, from the program. So again, do not try to do that. If ever masakpan to kung kinsay nagginato, if tinuod man gani, the consequence for that is you will be suspended to continue sa program. So meaning pahawaon ka na mo sa College of MedTech because that is not a value for a medical technologist. Dili mo dapat magingon ana when you become MedTech manikas because you'll be dealing with results sa inyong patients niya magsige mo panikas. So dili na dapat mabuhaton. Also, we saw during your P1 exams, there are some class studying mga previous notes or previous not notes but previous Google Forms, pictures of Google Forms from the previous batches. Okay? Those Google Forms and from the previous batches class, ang mga answers anak nila kay dili na tanan sakto. Okay? That is why, class, we give you study guide because we want you to read those notes. Nag-effort na inyong teacher, class, mag-make of PowerPoint presentation, nag-record because we want you to listen to that and to read the notes. Nya kamo pag abot sa inyo magsige na mo og salig sa mga previous batch nga naay Google Form. Remember, class, dili tanan ang mga question sa Google Form magsige nagbalik-balik, di ba? Napansin na mo dali na kayo nang human ang exams but you didn't read the question thoroughly. There are some questions that I tweak Na mga questions dito nga gibutangan na kog not. Na mga questions dito not siya on the Google form but wala na siya. So again, you read your notes class. Ayaw pagsalig og easy answer. Easy ang life. Remember, this is all for your own good. You'll be taking board exam. Okay? Dili na yun ana ang board exam kadali. And microbiology class, mind you, is not really an easy subject. So, karon pa lang gani, try to read notes. Ayaw pagsalig og mga reviewer, ayaw pagsalig nga dali imong life. Because if you ask interns, inyong mga ate kuya, na mga ni-interns or kanang mga padulong na mo graduate, pangutan sila and take nila sa mock board kung ilang gibuhat kay sakto ba to ilang ginaston-an before. Kana sila nga batch class, mind you, wala na sila recorded lectures. Kamo lang ang naay mga recorded lectures. Kato ilaha kay sariling sikap rato ilang study. So pag abot nila internship kay nangapa in town sila kay back to zero sila. Kamo, you already given a lot of resources. So maximize those resources. Okay? Ayaw pagsige og pagsalig na madali imong life because you are medical technologist student. If face-to-face pa ni class, mas grabe na siya imong study. Gani at your own pace pa ni siya kung gusto, kailan lang ka gusto mo basa, kailan lang ka gusto maminaw. But during your face-to-face class, if ever mag face-to-face classes na, right after the lecture sa inyong teacher, you will expect a short quiz. Okay? So ayaw mo pagsalig. You maximize all the resources that we gave you and be thankful and be grateful with that. Na-shock lang me. 11 ang exam pero wala pa 10 ang human na tanan. Okay? So again, study, this is already board subjects class. You're already on your third year. Mga professional subjects na ni siya. So, if ever, again, just a reminder, if ever dili makapasar og pakte, you will not proceed to Mycoviro next semester. So, ma-delayed na pud mo isa ka tuig. Di na pud mo ka-graduate. Dayon on time. So, maningkamot, magtuon. Any questions? Clarifications? Wala? Okay. If you have questions, again, or clarifications, message me on the group chat or Sir Luigi's class. You message Sir Luigi. No, we will try to answer that. If you don't have question, thank you for coming, everyone, or thank you for attending for this short notice na Zoom meeting. So have a great weekend, everyone, and please to study the notes that we gave you. Bye, everyone.
Thank you, sir.
Bye, thank you, sir.
Yes, sir.
Yes, sir.
Thank you, sir. Bye.
Sir.
Thank you, sir.
Eh.
Thank you, sir.